Great presentations, and there was no hook, so everything worked out just fine. I'm going to begin the session of questions, and then open it up to the audience for to the members, and then the audience for further questions as we go forward. Let me ask two questions, one related to sustainability and the other related to use, and another question related to the Apple recently that was just referenced, the research kit. Related to sustainability, one of the questions are really related to the key challenges to getting consumers to sustain, not use, but to sustain their use of consumer-facing health technology. And the converse of that is, what are the key challenges to getting providers to use the data provided by their patients' use of consumer-facing technology? So one is related to sustainability, and the other is related to the healthcare team to use the data provided by their patients' use of consumer-facing technology. So I'll open both those questions up to the panel and see where we can go with those.
Well, I'll just jump in on... oops. Green light? Okay, red light. That's like a user interface thing. Red to me says not good. But anyway, so on the sustainability thing, I know I've said a fair amount about it, but I do think one general rule is, if you can make it easy for me to continue to use something without going out of my workflow, as it were, as an individual, I don't, like when the battery runs out on something, or it's really hard to set, or I have to recharge it all the time, or whatever, at a certain point I'm going to be much more likely to drop it. So that's one comment. And then if I can comment on the physician usability part too, sure. Very often you hear, Patricia was talking about some of her colleagues saying, oh, I don't know if I want all that Fitbit data. Well, yeah, I mean, as the consumer, I'm not even sure I want all of that Fitbit data. But I think what we need is sort of smart software that helps us interpret key changes or things to pay attention to. Because we're going to be increasingly measuring and recording more data about every aspect of our lives. And none of us is going to want to review all of it. So what are some ways that we can use intelligent technology to make sense of the data and highlight useful key points? And that will be worthwhile I mean, I wouldn't want to send my poor provider everything I've eaten for the last 2 months. Some people do.
I would agree with those points. Also, I think the return on investment, that's true for patients, and it's also true for providers. So I think that we need to evolve a little bit in our informatics infrastructure so that we have more of a big data approach. We're able to process the data in a way that it can then be presented in views that support decision-making depending on who the user is. And so that's part of the return on investment is sort of developing the technology so that we can support decision-making when these decisions need to be made. And then I think there's a return on investment both for patients and for providers. So there is evidence that for a patient, one return on investment is that if the data is valued and used by their providers, that does make them more activated and more engaged in their health care. So, I think communicating that, I don't think all providers know that, and I don't think all providers understand exactly what patient activation is. So these are all skill sets that I think we have to, reinforce and teach. They don't come naturally. None of my colleagues would say that they aren't providing patient-centered care, but how they define that and what that means in terms of their interaction with the patient, there's a lot of variability, and I think we need to have some standard competencies around that.
If I could just add, I think there's a useful distinction potentially between what generates value for an individual user. Maybe it's just getting a piece of data or some contextualized data back. And I know patients like me, this has been their mantra, you give something, you get something. And that's certainly helped keep a steady stream of people engaged in that site. On the provider end, I think the sort of threshold for evidence is higher. And, I've talked to many who say, I want to know before I totally redesign my systems and my processes that I'm going to get value from doing this. I think the challenge and the tension that creates, particularly given the different streams of data that we have at our disposal that we're just starting to capture and understand, is that you test one and maybe it doesn't actually yield, maybe it's not the greatest thing since sliced bread, but that doesn't mean that something else isn't going to have tremendous benefit. So I think we have to be really cautious, if we sort of based all of our decisions on, one evaluation of EHR implementation, we wouldn't go any further, right? But we shouldn't do that. We have to appreciate that there's going to be a longer slog to go through to get there, and an important one.
Alison, you brought up EHRs, which I didn't think I was going to speak about, but I will anyway. What are we using the data from EHRs for?
Well, all kinds of things.
So tell me.
Right? That's like the classic master's student, defense dissertation, right? It depends.
It depends.
So I think they are being used for quality improvement initiatives, for population health management. I think I was talking to someone recently trying to explain, what I did, which is really harder than it should be. And I was saying, historically, there's stacks and stacks of paper records, and would you ever want to wade through them to sort of find your information? And how could you reasonably expect that any of your providers would ever do that? And of course, they thought, oh, they don't. This is the reaction. They didn't do that? They didn't know? No, they didn't know. And so they couldn't say, of the 2,000 people I see in my practice, these are the ones who have, XYZ conditions, or these are the ones with unmanaged diabetes, and therefore I need to focus my energies over here. So I think there's a lot of characterizing of populations and segmenting them and trying to assign sort of some type of risk and sort of proactive plan for mitigating risk that's happening. There's a lot of other stuff that's happening. I mean, in my world, folks are using them for comparative effectiveness research studies. But the challenges of getting sort of research-ready data and navigating the data quality challenges are really tremendous. But they're making headway.
So that patients are actually contributing to society without really knowing about it.
Sometimes, yeah. Unless they fully understand the HIPAA waiver, which is actually one that I didn't, bring up, but for health literacy reasons, could we completely, change that?
Wait, can I pile on that? The other thing is HIPAA. People think of it as this blockage, like because of HIPAA, I can't get my health data. But everyone needs to know HIPAA actually guarantees your right of access to your own health information. And that should be just as much associated with HIPAA as this idea of keeping things private and secure.
So let me just then go to the Apple question and the research kit. As we know, the Apple research kit allows researchers to develop apps that really take advantage of the many data sources available on these multiple mobile devices. So there are several questions that come from that, since it's relatively new. Number one, how does it actually affect research? Number two, will it skew the data, or will it lead to perhaps increased disparities? And also, which we already began to discuss, what are the ethical and privacy implications of such a system? And my brief knowledge of this is that it's beginning to take hold somehow, as Apple usually does. And so perhaps we ought to answer, or at least think about those questions early on. So I'm going to just ask that for the panel. Not easy questions.
I'm happy to.
Go right ahead. I set you up.
All right. So, I mean, I think one of the things that Apple did was they set a set of expectations for those who want to play in that research kit space. So they did establish some baseline levels of, providing disclosure, et cetera, et cetera. The thing, I think the point you mentioned about skewing is really an important one. I'll note, and this is dated, because I heard this last week at some point, but I think within the first few days, like 48,000 people had signed on to participate in research studies, and I'd be hard-pressed to talk to anybody who's ever had that much success recruiting people that quickly. Now, the interesting sort of skew dimension that I hadn't thought of until I was talking to someone last week was it's just Apple. So what about all the Android users, which happens to serve a lot of, potentially vulnerable populations? And so there's now this pressure to build, a comparable, hopefully somewhat similar mechanism to conduct research and apply the same tools and the framework to the Android space. So I don't think it's going to be exclusively sort of an Apple endeavor for long, at least based on the conversations that I'm hearing. And then I think, there's really there are endless opportunities and far larger sample sizes than we've enjoyed through, some prior research efforts. But obviously, that means there's a whole other set of methodological and other issues that are going to get triggered that I'll be excited to learn about.
So a comment on Apple specifically. I think given that Apple is such a powerful and popular consumer brand, part of what that company is doing by getting into this space, not only through research, but through the basic set of health kit applications, is helping to put health on the map for, now we'll go back to this, the average person, because the Apple user isn't necessarily representative of all Americans. I think it's 40% penetration of smartphones in this country are Apple. I'm not positive on that. And they do tend to be higher income because it's a more expensive product. And Apple's clear about that. They go after a, more of a luxury market. They're a luxury brand. But I think their entrance into this space combined with their skills at marketing and mainstreaming things, part of what they're doing is just changing mindsets such that people associate health with their phone and they start really feeling like these devices and apps and tools are part of the mainstream experience of their lives, and kind of paving the way, as Alison said, for perhaps other similar, not necessarily Apple branded, but other functions that are similar. Like, why shouldn't research, which has for so many years been mostly conducted through funded studies that take a long time, those have their important place, absolutely, but why not augment it with real-time data from real-time people, whether they're using an Apple phone or not? But Apple's kind of like the gateway, opening the gateway, I think, so that others will follow.
Thank you.